once again. Today is our 1220th day. Today's our guest is Dr. Suraj Singh Bhadoriya. He's MD and Ph.D. He's working as assistant professor in the Department of Pharmacy in Parul Institute of Homeopathy and Research, Vadodara. And he had published many research work. He has already taken one class about the research work, and today is the second session of him. That was very wonderful presentation, and published many research articles, and attended many workshops. And today's our subject is homeopathic research. Quality control of homeopathic medicine. Today's our subject is quality control of homeopathic medicine. I am welcoming Dr. Suraj Singh. He's already, you made him as a host.
I have made him audible.
Okay. Sir, welcome.
Am I audible?
You speak, sir?
Yes, sir. Am I audible, sir?
You are audible.
Okay, sir.
You can upload your.
First of all,
You can upload your.
Yes, sir.
Now.
Okay, sir. Is it visual?
Yes, visible.
Okay, so shall I start my presentation, ma'am?
Yes.
Okay. First of all, good evening to everyone.
And one more thing I wanted to ask you, sir. This is the front page of your computer. Have you started sharing the slides?
Yes, ma'am.
No, but
now we can see.
Slide is not visible.
Sir, now it is visible, sir?
No, sir.
Visible, but what we are seeing is desktop downloads documents. That page it is visible.
You have not opened the PPT. You have not opened the PPT.
1 minute, sir. Now it is visible, sir?
No, sir.
No.
Sir.
Have you shared the screen?
Yes, ma'am. Just wait, ma'am. I already shared this, ma'am. Just wait, ma'am.
Yeah, you shared the screen, but now your arrow is in the Suraj International 2.
Now it is visible, ma'am.
Actually,
no,
sir,
not open.
You
can read.
Ma'am, just wait, ma'am. Share. Okay.
Yeah. Start.
Okay. So first of all, good evening to everyone. Today, this topic is very important for everyone because nowadays we are going to prepare a different formulations like hair oil formulations, shampoo, liniment, ointment. So generally, this word standardization, it is very huge because standardization, it determines the quality control in terms of the quantification or the qualification of major phytoconstituents or the drug components in all varieties. So generally it regards with the quality control. So there are different parameters and there are different level for the standardization. So when we talk about the basic parameter for this quality control, so the basic parameters are, the first is organoleptic evaluation. So what is organoleptic evaluation? So this organoleptic evaluation, it based on the quality control of any drug or medicinal product by our senses, like smell, touch, taste, the color. So these are all the organoleptic. Suppose if you prepare any formulary or any stock sample, so when we kept this sample for the stability time interval approximately around 15 days or 13 days, 6 months, 1 month, so generally the color will change. Sometime the odor or the smell will change. Sometime there is a precipitation. So these all are the organoleptic evaluation. So what we can do, we are going to qualify or quantify such products on the basis of our senses. So these are the organoleptic. The second important evaluation is the macroscopic evaluation. So what does it mean? As a word, macroscopic, it determines the structures of the leaf, the patterns of the vessels, how the leaves are arranged, how the flowers are arranged, how many flowers in a single petals. So these are the macroscopic, because these are the structures which are visualized, which are easily determined by our senses. So there is no such what we can say, the microscopic or somewhere the dissecting that particular part. So this is the macroscopic. Okay, so the third is the micro. Micro means a section, a parameter which done under the view of microscope by dissecting or by somewhere more and more resolution of that particular part of the drug. So this is the microscopic. Suppose if we want to study the structure of the drug component, if we want to know about the margins, either it is regular or irregular, either there are some other components, what are the size of nucleus, what are the different arrangement of cellular components. So this is a microscopic. It is under the section of a microscope. For example, if we want to study any drug compound or the size of particle under the electron microscope, TM and SEM, so these are the microscopic evaluation. Whereas the physical or chemical evaluation, it based on the physical properties or the chemical properties. So these are in general standardization or the quality control of the drug substance. Now you can see in this slide, what are the organoleptic? As you know, the smell, color, taste, consistency, these all are depending on the biological parameter, depending on the chemical property, depending on the physical property of that particular alkaloid or the phytoconstituents or the metabolites which are already present in the drug substance, which are in the raw form, which are in the crude form. So this organoleptic is always done in all this parameter. So it determines, it gives you the significance related to that particular drug. Now here you can say these are the samples from our homeopathic medicine. In first you can see it is Thuja occidentalis. So it is the another drug. And the second one is the Lycopodium clavatum. So these are the two different samples. So here you can see the change difference in their color. Here you can also go for the odor, different characteristic odor, or here you can see the consistency also. This Thuja is more dark in color, whereas this Lycopodium clavatum, it is very light and transparent in color. So these are what? These are the organoleptic evaluation. So these are just examples. Generally in our lab, we go for this preparation, like comparative study of the prepared Thuja with the standard Thuja occidentalis, like GMP certified pharmaceutical company. What are the differences on the terms of absorbance or the wavelength? So these are in general practices that we have to use this in our laboratory purpose. This is the macroscopic. Now you can see the different shape of the leaf. This is the linear one. This one is the oblong. This one is the elliptic, lanceolate. So these are the different structures, the morphological classification of the leaves. So what it determines? It determines the different characteristic feature of the drug substance. So suppose if we want to collect any drug, any extract from any particular source, so the physical parameters plays a major role. Sometime there is a what we can say, the doctrine of signature. Suppose the leaf of euprasia, it looks like a eye shape. So what is the doctrine? This particular medicine has affinity towards the eye disorders like glaucoma, like conjunctivitis, viral conjunctivitis, bacterial conjunctivitis. So these are the basic characteristic feature of that particular evaluation. So again, it is very, very important for us. Now, the next one is, it is regarding with the microscopy. As we know, this microscope, there are different dimensions. As per this, we are going to know the arrangement of cells inside the drug. We are going to determine the structural pattern. Either they are in cubic shape, circular, oval. So what are the structural pattern of that particular compounds? Pigmentation, foreign bodies. So these are in general microscopic view. Generally, what we can say, for any type of this marker, standard marker, for example, in Thuja occidentalis, the Thujon is the standard one. It is the active principle. So there are two types of Thujon, alpha Thujon and beta Thujon. So generally, in this microscopic evaluation, we are going to qualify or quantify that particular marker, because as per the pharmacological action, this Thujon is the major part which has that action on the living organism. Either it would be the in vitro, in vivo, or the animal, or somewhere the human trial. So the basic action is because of the Thujon. So here this microscopic evaluation, it is very, very the most important for the active principle, for the alkaloid, which are most important in the terms of the pharmacodynamic. So this is the important part for such parameters. Or generally, what we can say, if we want to do such type of evaluation, so generally it is done by the electron microscope, SEM and TEM. So these are the different types of electron microscope. So what it means, it has a more and more resolution to determine the different structural pattern, the size of that particular compound which is present in our drug substance, which is present in our medicinal substance. So suppose if we want to standardize the any high dilution, because nowadays what happened, we have a lot of challenges towards the ultra high dilution. Here we are not talking about only mother tinctures. So generally for ultra high dilutions, to determine the very minute massless particle under the section of microscope is itself a very biggest challenge. How we can determine? Somewhere we can know that these are maybe isotopes, these are maybe the nanoparticles, these are maybe the water memory. There are different hypotheses for such ultra high dilutions. So what we can say, we have to take that particular sample from ultra high dilution and just see the structure, the size particle under the electron microscope, SEM and TEM. So this will give you the conclusivity in the size, in the diameter, in the pattern of that particular nano or the massless particle. Because in potentization, what we are going to do? We are going to decrease the quantity. We are going to increase the quality. We are going to facilitate or convert these mass particles into massless particles, which are generally isotopes, and they are generally associate with the electromagnetic field. So this is the logic of potentization. What we can do? We are going to facilitate this massless particles from lower shell to higher shell. So it is in general explanation. Whenever we do PhD in pharmacy and whenever we have this higher degree for this particular domain, so generally it is like to accept such challenges. In bachelor degree, it is sufficient to just explain the definition. What is potentization? It is the mathematico-mechanical process to around the latent curative power of medicine. It is sufficient for BHMS. But when we come for MD, when we come for PhD, now we have to do this at the higher or more and more resolution, so that we can validate our science. Why I am focusing more on microscopic evaluation? Because our medicines are very minute. We can't say that in higher dilution there is nothing. It is just like a plausibility phenomena or something like a magic effect. No, they have some particles, but they are very minute. They are travel in the form of wave. They jump from the lower shell to the higher shell by acceleration of, yeah, by each and every consecutive strokes or force in acceleration. So these are generally present. But how we can determine the structures? So this is one of the biggest challenge for us. So we have to validate this part. Electron microscope is one of the option. Another one, you can also think about the Raman spectroscopy. By this spectroscopy, we can just determine the structure in terms of this HNOH bond vibrational frequency. Generally, in our ultra high dilution, there is one theory, that is water memory theory. So what we can say, in ultra high dilution, this water molecule act like a messenger. Okay, so when we do this, so we have to do the standardization of such ultra high dilution by the Raman spectroscope. It is discovered and the founder is by C.V. Raman. So he was the founder. So that is the major aspect. How we standardize the ultra high dilution. Today, this topic, it is not a topic, it is a biggest challenge for us, especially in the field of homeopathy, because we are more talking about the dynamic system. We are more talking about the qualitative aspect. We are not always related with the quantitative aspect. Whereas in the modern pharmacology, they are mostly based on the quantitative analysis as compared to the qualitative analysis. So what we can do? We have to justify, we have to validate our results on such parameters. Otherwise, our science is just like a pseudoscience. So this is very, very important that we have to evaluate. Now moving towards the next slide. Generally, now these are our students of first year. In every slide, I always have this habit to put the photos of our students, because ultimately we are also joined with the academic part. So these are our first year students, BHMS. So they has one product, what we can say, a project related with the microscopic evaluation of sulfur particle in 1x and 2x and 3x. So what we did, we evaluate the sulfur particle in 1x, 2x, 3x by IR spectroscopy, FTIR. Fourier transform infrared spectroscopy. It is a type of spectrophotometer. So here we determine the size or the transmission at different wavelength in different potencies. So these are the first year students. who always have this type of what we can say the research attitude towards validation, towards the scientific approach that should be in BHMS, not only in MD, not only in PG, not only in PhD. Since from first year, we have to validate our results. What are the differences between sulfur 1x, sulfur 2x, sulfur 3x, 12x that we have to validate in terms of standardization? Now you can see in the next slide. These are the pictures regarding with this standardization of sulfur. Now these are the pictures. In first figure, you can see the sulfur particle, the size or the structure of sulfur. It is just like small pieces of glass with the irregular margins. They are just like a very light in color. So these are the microscopic view of sulfur particle. So we have four major categories: crude sulfur, sulfur in 1x, sulfur in 2x, sulfur in 3x, and sugar of milk as a control group. So these are the different groups while doing the microscopic evaluation. So this is another our research project. Afterward, we will go for more and more standardization of this sulfur 1x, sulfur 2x, sulfur 3x as compared to a crude sulfur along with the sugar of milk. Because ultimately when we do trituration, so the vehicle is sugar of milk. So we have to also take this sugar of milk as a control group. Now in next slide, you can see the analytical techniques in the standardization. What are the different analytical techniques? Now this is the major part. So the first is UV visible spectrophotometer. So this UV visible spectrophotometer, it is one of the very basic instrument for any type of laboratory procedure, for any type of analytical procedure, for any type of forensic or some other pharmaceutical. This instrument is commonly used. So this is the spectrophotometer. The second is HPLC, high performance liquid chromatography. It is a type of chromatographic technique. TLC, it is very basic for chromatography. It is generally used in our institutional level, in our school, in our colleges, in our universities. So it is very common to just separate the pigments in our drug substance or in our solvent. HPTLC, it is the high resolution technique for chromatographic analysis. Gas chromatography, mass spectroscopy. So this is very important spectrophotometer. It is used to determine the various functional groups which are present in our drug substance. Mass spectroscopy, generally it is for the liquid or the solvent system. Another one is that is NMR, that is magnetic resonance. So this is the basic. These are to be needed for the standardization. Either they are raw substance, either they are the finished product, either they are the just preparing part. We have to standardize this on different parameters, on the parameters of their chemical reactions, on the parameters of their segregation, on the parameters of their physical properties, on the parameter towards their absorption capacity, on the parameters towards their magnetic field, their electrical property. So these are the different properties. You can say standardization is just like a sea. There are different minute and major compounds that we have to evaluate. If we are capable to evaluate all these compounds, so ultimately you are going to validate more. If we are unable to quantify or qualify such compounds by all this spectrophotometers, so something there is error in our identification of drug substance, something there is no validation of our sources, something there is no validation of our preservation of drug substance. So these are the different rules for such analytical procedure. Now moving towards the next part. Now you can see FTIR. It is another spectrophotometer or another technique for standardization, Fourier transform, infrared spectroscopy. Now individually, we just go through this. What is UV visible spectroscopy? Generally, it is based on the UV light. So this spectrophotometer, basically it depends on the absorption capacity. Okay, so suppose if we prepare any liquid, any solvent, any formulation, so how much absorption is there? Okay, so suppose if the solution is more turbid, if the solution viscosity is more high, so the absorption capacity is also high. So these are the absorption. So this spectrophotometer, it has some principle like Bird-Lambert law. So Bird-Lambert, these are the two different scientists. And what is the principle? The absorption is directly proportional to the concentration. So if the more concentration, more absorption. If the more path length, more diameter, so more absorption is there. So this is the UV visible spectrophotometer. Okay, so this spectrophotometer has a particular wavelength. Like UV, it is around 200 to 400 and 400 to 800, that is visible. So these are the wavelengths. Suppose if the solution is very light, so generally we go for this more than 400. Okay, if the solvent or the solution is very dark in color, more concentrated, so this 200 to 400 wavelength is sufficient to evaluate this in terms of the absorbance, or what we can say the lambda max in mathematical expression. So these are the different parameters in the UV visible spectroscopy. Now you can see this is the image for the UV visible spectrophotometer. This is the graphical presentation. Here you can see x-axis and y-axis. So this x-axis is basically for the different wavelength and y-axis is basically for the absorption capacity. So here you can see the small peak 1 and 2. There are two different errors 1 and 2. So these are the peaks of the compound. These are the peaks of the maybe phytoconstituents. These are the peaks of maybe your alkaloid. These are the peaks of maybe your metabolite or active principle. So this is the absorption peak. Here you can see it is very minimized, it is very less. If this peak is more, then absorption is more. If this peak is less, then absorption is less. So it is always in correspond to this particular wavelength. Suppose this peak number 2, it is in between this 600 to 700. So this is the range where you are going to qualify this particular compound or the basic this particle in that particular absorption peak. So this is the validation. This is the very basic one. Here you can see this is our he is Mrudul Tripathi. He is our first year student. He always do this spectrophotometric analysis. Suppose if he prepare any formulary like shampoo, hair oil. So first we have to evaluate this in terms of absorption. So this is the real peak. Okay, so this is the spectrophotometer. Now next you can see this is the high peak. In previous it is small. Now you can see here it is more elevated as compared to the previous one. So it may be because of the different compound, it may be because of the different viscosity, it may be because of the different concentration, it may be because of the different path length, it may be because of the different nature of the drug substance. So this may vary. So these are the UV visible spectrophotometer. It determines the absorption peak of individual compounds at different wavelength that we are going to determine. In next, you can see this is the overlay. What we can say? It is the overlay. Here you can go through this two different peaks of two different solvent, of two different drug compound, of two different nature of drug substance. So these are the overlay. Ultimately in this figure you can just go to compare this peak with this peak, है ना? So these are the in general comparison. So this is the UV visible spectrophotometer. Next is FTIR. Now, what is FTIR? It is the Fourier transform infrared spectroscopy, and this technique is generally used to identify the various functional groups or the chemical compounds or the constitutions or the constituents or any metabolites which are present in our drug substance. Either they are raw, either they are finished product, or either they are in process, the preparing part. So these are the basic principle of what we can say the basic use of this IR spectroscopy. It is widely used for the identification, quality control, manufacturing process for the drug substance. Now you can see in another figure, this is the FTIR analysis. Now in this figure, you can see there are n number of peaks. Some are the peaks, some are the valley. So these are the different peaks at different wavelength. So these are the functional groups. Now here we have to evaluate the highest peak first, not the valley part. So here in suppose in this between 2500 to 3000. So suppose this one is the highest peak. So which compound it is? Either aliphatic compounds, aromatic compounds, or some other phenols, carbon nitrogen group, ammonia. So we have to evaluate the functional groups, because ultimately when we prepare any medicine from any raw substance, any sources, plant kingdom, animal kingdom, chemical compound, synthetic, so we have to evaluate this in terms of different transmission, different wavelength at different absorption capacity, so that we can determine how many compounds are there. Either they are more in phenolic compounds, either they are more in aromatic compounds, non-aromatic compounds, because in plant, in vegetables, they are more rich in such functional groups. Okay, generally in chemical compound there is only single, but when we talk about the plant, when we talk about the vegetable, so these are very heterogeneity and very heterogeneous structure in their metabolites. There are thousands of compounds that we have to evaluate first. Afterward, then we will go for more and more validation, more and more standardization by the different techniques, by the different tools. Now, in the next slide, you can see just it is the electric potentizer or triturator machine. It is available in our pharmacy lab in Parul Institute of Homeopathy Research, Parul University, Vadodara, Gujarat. So generally, it is the electric potentizer machine. Here we can go for this preparation of trituration, 1x, 2x, 3x. So it is just like a preparation part. So for PG, we have to keep these instruments in our lab. And here you can see the second figure, it is regarding with this trituration, the drug part along with the sugar sugar of milk. So it is generally the process of the potentization for those drug substances which are neither soluble in the alcohol as well as the distilled water. So these are the mother powders. So it is the general process of our preparation. Actually, in our homeopathic pharmacy, we are always talking about potentization. We are always talking about succussion. We are always talking about the trituration. But nobody is going to talking about the chemical, physical property of the alkaloids. Even though in PG students are forget about the active principle of lycopodium, they forget about the active principle of belladonna, they forget about the active principle of arnica montana. We just know about the process of preparation. So it is just a half knowledge, and half knowledge is always dangerous. Whenever you prepare or whenever you validate any methodology, so always justify to your raw material, your medicinal product, but because ultimately you are going to prescribe this medicine to any individual for any particular disease condition. So suppose if the concentration of ferulic acid is the active principle of Lycopodium clavatum. So that we have to validate, that we have to know or determine the concentration of ferulic acid in the Lycopodium clavatum. That we are not going to do. We are just going to prepare and just dispense it, just store in the hard glass bottle. But what about the validation? Whenever there is some controversy, whenever there is some something related to this, so we go through the dynamization. We go through the theory of vital force. But always think about the properties first. Then we go to identify such compounds. Then we go to standardize this. Then we go to prepare the formulary. So this will be very easy for us. That is most important part. I think we have to focus more and more over that. In next slide, you can see HPLC. It is another type of chromatographic technique. It is high performance liquid chromatography. It is not thin layer chromatography. It is based on the liquid chromatography, and it is generally used for the qualification and quantification of those compounds in which there is a mixture A, B, C, D, E, F, G, etc. So we are going to segregate, we are going to qualify, we are going to quantify, we are going to determine that smallest mixture or compound in our solvent. So this is HPLC. Okay. Generally what homeopath do, they just take their sample and just send to any analytical lab without knowing about the concentration of the solvent, without knowing about the morphological, or what we can say, the physical and chemical property of that particular solvent, without knowing about their solvent system. So this is not way to validate our science. I think today we had this session with PG students that they are going to deliver their case presentation. So they had some discussion regarding with calcarea carp, sulfur, and lycopodium relationship. So at the end, what we did, we always have the pharmacy part in prescription writing. Why? Pharmacy always starts from beginning. If you can say that lycopodium and calcarea, sulfur, these are having relationship, these are trio. So on what basis you are going to make the relationship? Are you going to quantify or make the concentration of these three different medicine and just compare this in a solvent system? No. So on what basis you are going to say these are the complementary, these are the follow well? There is a pharmacy. If suppose lycopodium is A, calcarea is B, and sulfur is C, so you can take the stock sample, the formulary of this sulfur as a separate, calcarea as a separate, lycopodium as a separate, and just divide it in a like ratio 1:1:1. Now what we can do? We have to take this as a separately or in a mixture to determine the absorption of calcarea carp, to determine the absorption of lycopodium, to determine the absorption of the sulfur. If there is multiple peaks, by UV visible spectrophotometer. So you can say they have relation. If there is no peak, if it is flat, so generally there is no such relation. So these are the validation. We can't say that at the end of case taking, pharmacy is there. Now we talk about dosage, we talk about the prescription writing. No, it always starts with the beginning of your case. So that we have to know. Now you can see in HPLC, this is in general process that we have this solvent system. This is the solvent. This is the pump where it goes to transmit into another phase. Injector. Here we are going to inject some other media. This is the HPLC column. It is generally used for standardizing such compounds. These are the detector. These are the waste. And by this detector, we are going to have a different peaks at different wavelength, at different transmission. So here we are going to either do the qualitative analysis or either we have to do the quantitative analysis. So this is the HPLC. So it is used for both purpose, quantitative or qualitative. If we have the standard marker, suppose in belladonna, the active principle is atropine. So if you are going to compare this atropine or belladonna in this HPLC, so this is the quantitative analysis because you have the peak of this atropine along with the peak of this belladonna. So you are ultimately going to compare the RF value of this atropine with the RF value of this atropine in the belladonna concentration. So this is the quantitative analysis. If we have only the medicinal product like belladonna only without atropine, so this is the qualitative aspect. So that we have to validate. Next, now this is the GCMS, gas chromatography mass spectroscopy. This technique is generally used for all type of liquid, gaseous or solid samples or the compounds. If the sample is prepared by the oil, like hair oil, by different oil like essential oil or somewhere we can say coconut oil, mustard oil. So this technique is not fruitful or feasible because it is having more viscosity. So what we can do, those samples, suppose sanitizer. So the main base is the alcohol. So it is volatile. It is easily evaporated by the atmospheric contact. So that we have to do validation of this sanitizer alcoholic base by this GCMS. Okay, gas chromatography mass spectroscopy. So generally it is used to determine such functional groups. Mainly they are the volatile. They are in the gaseous form. They are easily gets evaporated. Okay, so when we go for the standardization of oily base by GCMS, so generally it blocks in the capillaries. So we does not want this type of validation. Okay, so your sample should be very clear. Your sample should be very volatile and they get easily transferred. So this is GCMS. So gas chromatography mass spectroscopy, it is for liquid, gaseous or solid samples. Got it? Now in the next slide, you can see what is GCMS. Now in this figure, you can see these are the peaks. So these peaks are because of the different compounds, different alkaloids, different phytoconstituents. So these are at the different wavelength. This is the retention time per minute. So these are the GCMS. Okay. So in multiple peaks, it represents the multiple compounds. If the single peak is there, so it represents the single compound. Okay. So suppose if we prepare any hair oil by the n number of mother tinctures, so it represents the different multiple peaks. If suppose we validate only belladonna, single compound, so it represents only a single peak here. So this is the GCMS. Okay. So what we can do, you can see the trio, retention index, accurate mass, molecular weight. So these are the three main factors on which GCMS depends. If more molecular weight, so it is not easy to quantify or qualify. So the molecular weight should be less. If it is less, so it is easy to determine or identify. Okay. If the retention index, if it is more, then more number of peaks. If it is less, then it depends from different drug substance. Accurate mass, so it is regarding with the concentration of that particle. Okay, so it is in general GCMS. In next slide, you can see the liquid chromatography mass spectroscopy. In liquid chromatography, in liquid chromatography mass spectroscopy, generally it is used for the analytical procedure where it is going to segregate all the mixture which are present in our solvent media. So it is liquid chromatography mass spectroscopy. When we talk about the solvent, so it should be less in viscosity. It should not have a n number of mixture where the viscosity is more. So it is difficult to identify such compounds. Another most important thing is your solvent should be very miscible. If it is immiscible, if it has some separation or segregation, so it is not going to standardize. Generally, we have to say like whenever we buy any syrup from the market, so after 2 to 3 days or 15 days, there is a separation of alcohol and the drug composition. So this should not be done in our sample, in our medicine, or in our drug substance. So this is the liquid chromatography mass spectroscopy. It is again useful for what we can say identification and segregation of n number of compound in a single complex mixture. So this is the another spectrophotometric analysis. In figure, you can see this is the graphical. It is in general the working principle of liquid chromatography mass spectroscopy. How it is going to validate. Here you can see it is the column. Now it is going to flow in this capillary. Now through this column or the capillary, now this is the mass spectroscopy. Here it is going to determine your functional groups, your compounds. So it is in general working principle of liquid chromatography mass spectroscopy. So generally it is mostly based on the viscosity of the solvent. Okay, suppose if the concentration of any solvent is more due to n number of complex mixture, so we are not going to make it as a standardized. So that's why in any type of formulation, our sample should be clear, it should be miscible, it should be transparent, it should be very like what we can say a simplex variety. When we mix n number of compounds, so generally the what we can say the pharmacological activity of A and B may hamper. So that should not be done in any type of formulation. That's why Dr. Henneman recommended a single medicine, not a complex system. Now in another one, this is the electron microscope. As previously we had discussed about this electron microscope, what is the utilization, what are the different types of electron microscope. So generally it is useful to determine the size particle, to determine the structural variance, to determine the what we can say the margin or the cell difference or the cellular permeability of that particular solvent. So this is very high resolution technique. So generally this instrument is not available in every analytical lab, just like a UV visible spectrophotometer. It is generally used in our pharmaceutical, in our industry, or some other higher centers. Okay, so this electron microscope, it is again very, very useful for the microscopic evaluation. Got it? If we talk about the physical parameter, if we talk about the chemical parameter, so this type of tool is not going to validate more. It is more about the visual impact of your particle size. Now you can see the figure of this particular apparatus. Now it is very costly also. Per sample, it may vary from different lab, from different institution, from different university. So the cost of each sample may vary. It is very high costing, and for any type of this analysis, we always have some few points. First, the viscosity should be maintained. Second, there should not be more complexity in our media. Third, it should not be contaminated. There should be proper storage or preservation. Fourth, it should has in comparison of the standard marker, so that we can evaluate that. Suppose if we took the Thujon as a standard marker along with our solvent, so we can easily identify the structure of Thujon in our solvent media as a comparative group, so that we can know about this spectro or this microscopic evaluation. Now the another one is NMR. Before going to, hello.
Yes, doctor, we have only 5 minutes more. I mean, 6 minutes. So I think we will continue the session in the next. We will continue. You have more slides, right?
Yes, madam, NMR, and afterward, ma'am, only few slides, ma'am.
Okay, okay. Then we have only 6 minutes. 6 minutes. So.
Shall I continue, ma'am, in very super, not in
Fast.
brief?
So now you conclude this, and afterwards we will continue with the next class.
Okay, okay, madam. So
Because we
I
have,
finish.
we will discuss in the next session.
Okay, okay, madam.
Now
Okay.
you can conclude after showing 2-3 slides. Okay.
Okay, okay, ma'am. So finally, these are the different methods for the qualitative or quantitative analysis. Now, this is our last slide. It is our achievement. From the Department of Homeopathic Pharmacy, we publish our 3 books based on the compendium or the preparations or the evaluation of drug substance in an advanced technique or the new methodology as compared to the modern pharmacology by the spectrophotometric technique. So these are 3 different books. These are published by the Department of Homeopathic Pharmacy, Parul Institute, Vadodara, Gujarat. So it is our achievement. Thank you, ma'am.